Hello, dear children. A pleasant good morning. And this is Priyadarshini, your NORCET coach. And hope how many participants are there? Only 2 participants. Shall we wait for people to join? Okay. So let me introduce about myself. I'm Priyadarshini, completed my undergraduate and post-graduation in medical surgical nursing, specialized in critical care. And currently, I'm going to discuss about your fast track MCQ under nursing management and nursing education. Without further delay, let's go into the session. Okay. So first, when we talk about nursing management and nursing education, as an OSCET aspirant, what we actually do is we always skip these hurdle subjects because most of the questions will not be as asked in the NORCET examination based on this nursing education and nursing management. But it is not the point. There is always students who get inside the NORCET examination or who crack the examination with 0.5 percentage, and there is also students who come out of the examination because of the 0.5 marks. So 1 or 2 marks is also playing a vital role in making you to the success part, right? So you have to concentrate on nursing education and management, which plays a pivotal role. And sometimes the most important questions, to approach those questions, you need some critical thinking and managerial skills. Those are attained by these questions. So you have to be so clear with the concepts to approach these questions. So today we are going to discuss few very, very important nursing management and nursing education related MCQs. Shall we start with the session? Yes. So the first question is, assignment of any kind of authority from a manager to the subordinate to carry out specific activity is known as. So here the key term which you are seeing is assignment of any kind of authority from a manager, any kind of authority. You always know task is different and authority is different. What does it mean by authority? Authority is giving certain kind of liberty to make decisions. Okay, so that is authority. So here both assignment and authority is given to by the manager to certain subordinates. What is the term? What is the specific activity is termed as? That is the question. I request you to put the answer in the chat box. Yes? No answers? Please give a guess. What is the answer? Okay. Let's see what is the answer. Always remember, when there is a question which is asking about the assignment of any kind of task or any kind of authority or any kind of work from the superior most person to the subordinates of that organization is always termed as delegation. Okay, delegation is a common term which is utilized in your nursing management aspect, where they allocate certain amount of work or task to the subordinates. And it also includes the authority, which means the power of making certain minimal amount of decisions by the particular subordinate. And also we have the other options, that is your centralization, staffing, and coordination. We will see in detail what is meant by centralization. The centralization is the concept where you have the various hierarchy in your organization, right? First, we have the organization, and the organization is having the manager who is taking care of the organization, and followed by we have various subordinates in the group. All right. So here, the decision-making authority is always the upper level of authority, which means the most of the important decisions will be made by the upper level of authority, that is the superior most person, that is your organizational head or manager. So the centralization is nothing but the power of attorney or the power to make decision is not given to anyone. It is completely in the part of the head of the department. It is not dealing with the subordinates. So that particular term is called centralization. Okay, centralization is simply that the power of making decision is completely depend upon the management authority or the head of the particular organization. On the other hand, we have another term that is called decentralization. What is meant by decentralization then? So it is just opposite to centralization, or you can tell like a contraction, like, which means in decentralization, what will happen? The power of making decisions will be will be characterized to all, like which means it is possible, they all the person in the organization is able to make decisions. For example, the manager is able to make the decisions, the organizational head is able to make certain decisions, and even the subordinates are given certain amount of uh, liberty to make decision in the organization. That is known as decentralization. On the other hand, other option, we have staffing. What is meant by staffing? Staffing is generally the process where you're recruiting the people, you're recruiting certain people to, very good, I received a lot of answers. C, that is the correct answer. So, like on the other hand, staffing is simply a recruiting process of recruiting the employees based on the roles and responsibilities, based upon their caliber. We are recruiting the employee, that we termed as staffing. And coordination. Nursing is always a coordinated job. We always coordinate with multidisciplinary departments. Like we coordinate with the physician, we coordinate with the radiologist, we coordinate with the physiotherapy, we coordinate with the nutritionist, and at the end, we always have the goal to provide quality care to the patient. So coordination is very important to achieve the proper quality care delivery to the patient. So this is about this question. Whenever you see a term of delegation or assigning any kind of task, it means it is delegation of work. So let's go to the next question. I hope it is clear. Yes. This is also one of the very important question which you have to attempt. And for this, I'll go with the question. A horizontal bar chart. Just remember, it is a horizontal bar chart that shows the project task against the calendar is called. So what is mean by horizontal bar chart that shows the project task against the calendar? Please put your answer in the chat box, dear students, please. I'm waiting for the answer. Yes. Yes, what is the horizontal bar chart? Not so clear? Okay, let me explain. Always remember when you find the word of horizontal bar charts, which is having the specific term of calendars and what are the project's task it is going, it is ultimately meaning the correct answer is your Gantt chart. So let me explain you in detail what is meant by Gantt chart. When we talk about Gantt chart, it is always used for small projects. Okay, always used for small projects. And how they characterize this Gantt chart, why we are terming it as a horizontal bar chart. For example, I am just drawing a Gantt chart now. Okay, here the task is I'm planning to do a okay, you're requesting me to go slow, so we'll do it. Okay, so remember, a horizontal bar chart that shows the project task against the calendar is called. So I said you just remember the word horizontal bar chart. Whenever you see such term, the project task which is assigned in the calendar way, it is always the Gantt chart. Okay, so I'll detailedly show you how the Gantt chart is actually looking. Okay, so for small projects, it is always used for a small project. For example, very small projects like constructing an intensive care unit inside the hospital. For example, we can take it. Okay. So for example, I'm taking from 2025. So I'm taking January, February, and March, April, and May. Okay. We are just allocating certain months to perform that particular task. So for planning for the construction of ICU, how much time I actually took or the project actually took is like it will be marked like for planning the ICU, I took just from starting of the January to end of the January. Okay, so this is how I mark the chart. Is that is clear? Okay, so until January, the complete January is taken for me, taken for the particular organization to complete the work of planning of ICU, right? How much time it is taking for me to plan about ICU. Then again, we are going to the another task. What is the task? Is budgeting for the ICU. Once we plan, we have to allocate a proper budget. So how much time for planning the budget? I am taking from February, from the mid end of the February. It is taken from the mid end of the February. From January end to the mid end of February, I am taking to plan the budget. And assigning the infrastructure, it took from March to April. It has took me to assign the complete infrastructure plan of the ICU. So this is how the Gantt chart works. Okay, it is always working for minimal and small projects. And here the concept is it is a horizontal bar chart, which is always implemented with a calendar aspect, which means what is the particular time taken for the completion of that chart. Okay, so here according to the 4 distractors, the most important major distractor which will be making you more distracted towards this question is PERT chart. What is PERT chart? It is also very important for you to learn about PERT chart. PERT chart is your program evaluation review technique. Sometimes they can ask you what is the expansion of PERT chart. PERT chart is your program evaluation review technique. So always remember Gantt chart is vice versa to PERT chart. Okay, PERT chart is simply used for larger projects. Okay, it is not for it is not for smaller projects, it is for larger projects. For example, construction of hospital, construction of big rural health center, or construction of a big primary health center at the center of the city, or building of a big corporate hospital. These are larger projects. So these projects will be coming under the process of this PERT chart. Okay, so in PERT chart, how it is happening is Gantt chart, the key term is what? It is a horizontal bar chart. On the other hand, PERT chart is something which is related to your network diagramming, which means a free-flowing network diagramming. For example, I'm taking you. So here, the organization, okay, or the organization head is a plan A, who is having the plan to construct a big corporate hospital, right? On the other hand, all government authorities, functioning, sanctioning of budgets and everything, allocation of area, resources on all on the B. And again, on the other part, recruitment process, selecting a proper validate candidate for working in the particular organization to improve the productivity. And on the other hand, we talk about this stakeholder analysis, what is meant by stakeholder analysis? Like when you are able to, when you are planning to start any kind of uh, business or whatever you want to do, and you always concentrate who are the target population whom we are going to attach. Like those people are termed as stakeholders. For example, for construction of hospitals, who is our major stakeholders? The patients are our major stakeholders. And for example, if you take for construction of a big nursing college, who is your stakeholders? Ultimately, the students and parents will be your stakeholders. So these are stakeholders. Stakeholder analysis I'm doing. Likewise, but a big concept where I'm breaking the task into few parts and I'm working on it. That is the PERT chart, and it is always utilized for your larger projects. This particular diagram is termed as your free flow network diagram. Okay, free flow network diagram. This is the key term for your what? PERT chart. On the other hand, we also have certain categorization in PERT chart. That is your optimistic time. Okay, optimistic time, most likely time, and your pessimistic time. So here, what does mean by optimistic time? Just remember this O, M, and P in PERT chart. Okay, what does mean by optimistic time? Optimistic time is something like that is the most appropriate time. Within that, I'll be completing the project. For example, I'm taking just 5 years to complete this project of constructing a big corporate hospital. Most likely time is something that where you put certain amount of hindrances or challenges and difficulties in constructing that hospital. On the third hand, we have this pessimistic time where you put uh, lot of difficulties, lot of challenges into that particular task, and you're calculating the time. For example, for optimistic time, I'm calculating that with minimal, very minimal amount of challenges, or even no more challenges, I'm able to construct the hospital within 5 years. With most likely possible challenges, I'm taking the hospital to be constructed within 7 years. like minimal amount of challenges. And on the other hand, in pessimistic time, which means I'm putting lot of challenges in the construction process where it may take from 9 to 10 years. So this is the concept behind this, and you have to understand this also. Like, and while learning about PERT chart, it is a free flowing diagram which is used for a larger number of projects, and it is categorizing into optimistic time, most likely time, and your pessimistic time. Is that as clear? Yes. On the other hand, we also have this milestone and goal, right? What is meant by milestone? When we talk about milestone in pediatric nursing, it is the growth and development of that particular child, which shows a specific different change in their growth and development process. When we talk about milestone in nursing management, it actually imparts like in this particular period of time for the past 1 year, what is the organizational achievements? Okay, what is the organizational achievements, and what is the greater thing or any awards which is gone by the organization, or breaking boundaries, or any kind of achievements, or that is termed as milestone. How much from this level to higher level the organization has been attained. So these concept is termed as your achievement process, right? So these are termed as like milestones. What are the goals? Goals is nothing but your like each and every organization will be having a common goal, right? Working on that goal is the concept, and this goal is no more, we are not creating any bar charts or any diagrams for attaining that such goals, right? So when we talk about Gantt chart and PERT chart also, you have to understand why we are utilizing these particular chart is to take a control over that particular task. Okay, it is not like just like that we can plan and things, and whatever time it takes, let it take. It is not like that. It has to be completed with a planned and proper appropriate time. So that is it. Controlling. Just remember the word controlling. These both concept is coming under control, which means control of the management over the particular task. Is that is clear? So next, shall we go to the next question? Yes. So Gantt chart is your correct answer. Always remember the horizontal bar chart is always your Gantt chart, and the free flowing network diagram is your PERT chart. Gantt chart is used for smaller projects. Your PERT chart is used for larger projects. Clear? Yes. Yes. Now we have another question, which is termed as, so which of the following SWOT elements you people are so much aware about SWOT analysis, right? So SWOT elements, and what are the internal factor is a key term here. What are the internal factors of an organization? And you also have to remember it is not for self, it is for your organization. So what is SWOT analysis? You know, SWOT analysis is your strength, weakness, opportunity, and threats, right? And here they are specifically asking about what are the internal factors? What are the internal factors that also within the organization? You have to differentiate. To learn about this, you have to differentiate about what are the internal factors and what are the external factors. So internal factors is which is in the control over the particular, which is in control within the organization. It is not outside the organization. Whatever in my control. If I am a manager of a particular organization, whatever opportunities, whatever things which is within my control, that I am telling as internal factors. Whichever is not in my control, which is out of control, I am telling it as an external factors. So what will be the most important answer for this SWOT analysis internal factor? The correct answer will be your strength and weakness. Okay. What is meant by strength and weakness? Strength and weakness of the organization is always inbuilt within them, right? Strength essence, the organizational capability to achieve more heights. And the weakness is what are the challenges, what are the difficulties within the organization, any shortage of staff nurses or whatever within the organization. That is the strength and weakness. It is completely inside the organization. On the other hand, when we talk about external factors, what are external factors then? Yes, ultimately, the rest of the two options will be your external factors. That is your opportunity and threats, your O&T. Because why opportunity and threats or external factors? The opportunities which is available is completely out of the organization, which means how much opportunity the organization have to improve their productivity, or how much threat, who are the competitors for that particular organization. So this is not in our control. Only by effective management techniques and utilizations, we can go through this, overcome this external intrinsic factors like your opportunity and threats. Always remember, in SWOT analysis, the internal factors are your strength and weakness, and your external factors are your opportunity and threats, which is not in our control, which is completely analyzable and workable when we have a proper organizational control. And strength and opportunities is a mix of both internal and external factors, and weakness and threat is also a mix of both internal and external factors. So we are rejecting all these three options. Is that as clear, children? Shall we go to the next question? Yes. So here we have the next question. Period of practical examination or practical experience and training in clinical nursing supervised by an expert of a particular field is known as. So here, a person, for a period of time, we are giving a practical experience training in the clinical nursing setup, and the student is also supervised by an expert of the particular field. It is very, very important term here in this question, expert of the particular field. And this is the recent ESI question which is asked, and you people always know about the important major things like what is mentorship, what is lecturing, what is a teacher and all. See, this will be a new term for you to learn about. Okay, so whenever you think like a practical experience or kind of training which is given by an expert person, what is the term or what it is known as? It is the question. So before that, you have to learn about what is the concept behind this. So I was working as a class teacher for nurse practitioners in critical care units in my previous institution. Okay. There, what we used to do is, you all know about nurse practitioners in critical care, right? It is a PG program where we do specialized and advanced care we will be doing, right? The curriculum of a teacher in the nursing college is planned according, like we also learn the BSc and MSc nursing and we come for teaching, right? So here, when we talk about nurse practitioners in critical care unit, the INC uh, itself trained the curriculum of those students to be beyond the nursing. Like, it is breaking the border of nursing, which means those nurse practitioner students are allowed to perform certain important procedures like insertion of your radial arterial line, insertion of your central line, endotracheal intubation. These are possible procedures the students are able to perform when they become a nurse practitioner. But these particular curricular components are not added in basic BSc and MSc nursing, right? So when we are just studied that particular curriculum, we cannot able to achieve that maximal. Because I cannot train a nurse practitioner students to perform the endotracheal intubation. We are always trained to assist in the particular procedure in emergency situations. We are performing also. So we are assisting even in central line insertion also. We are assisting in a radial arterial line insertion also. We are assisting. But in this case here, the nurse practitioner will be performing. So what we will do from nursing college side is, we will allocate the student to particular as per the interest of the students. For example, the student X is more interested in critical care nursing. Specifically, we have NICU and all major critical care units. If that student X is more interested in critical care nursing, what we will do is, we will pair up that particular student with a physician who is a MD on DM in critical care nursing, which means he is a subject expert. And what he will do, he will teach all the advanced curriculum or advanced procedures, which is mandatory to the student to learn, right? So this particular concept is known as preceptorship. They will be terming that, the student will be terming those doctors as their medical preceptors. So always remember, when we are learning from the expert person in that particular field, we term that as your preceptor and medical preceptor. So you might have got a proper idea regarding this. That is, what is the concept here? It's not mentorship, dear Janvi. It is not mentorship, it is preceptorship. Mentorship is the composition of both all your personal guidance and counseling to the students, teaching, education, everything will be coming under mentorship. It is not specifically designed for expert in the particular field. So I said you the example of nurse practitioners who are able to perform your uh, procedures, like various procedures which is not allowed by nursing, and they are also allowed to prescribe certain medications which is not allowed from our end, right? So for that, they need an advanced level of guidance and practice and teaching. So for that, we will be connecting them with the expert of that particular field. So that is always termed as preceptorship. Please keep that in mind. When we are connecting a nursing person to an expert in that particular field, we term it as preceptorship. Or even it is also applicable for nursing, because nursing faculties, where the nursing faculties is doing a lot of advanced courses in that particular course. Like we have certain advanced course and PG diploma course and certification in, for example, we have this ACLS trainer courses also, right? For that, now if I'm undergoing that course and I'm trained, I'm certified in that, I will become the expert on that particular field. So when the student is connecting with me to learn that expert advanced care, advanced skill, I will be the preceptor of the student. Okay. Here the mentor is who is teaching things, who is involved in all aspects like guidance, counseling, identifying the progress of the students and all. It is not, mentor is not an expert in that particular field. So here that is the key term in this particular question. That is your practical experience and training in the clinical nursing is supervised by the particularly the expert of that field is always termed as preceptorship. Always remember this. And remember the example which I given you for the nurse practitioner. And mentorship, I said you, and peer group support is like you will be batch of 5 students in the clinical settings, and you will be learning within you, exchange of knowledge, exchange of emotions, exchange of communication, everything will be coming as peer group support. Okay, it is not an expert kind of delivery of any kind of skill, right? And self-regulation is always within yourself, how you think about yourself, how you take things, how you critically think, how you make decisions. That is all self-reflection. What you think about yourself and how you perform certain competencies, that is your self-reflection. So here the correct answer is your preceptorship. Is that as clear? If you have any doubts, you can put in the chat box. So next, go on to the next question. Yes. All of the following are major penalties. Major penalties, the sense which is a negative term. Major penalties awarded for the employee for their serious misconduct. Okay. Except they have put a keyword here. Major penalties, which means major penalties, this is major punishments which is given to the employees for their serious form of misconduct. Except, yes, first is loss of privileges. What is the correct answer? Can you give me? What is the expect factor which is not a major penalty when comparing to the other options? The answers, please. Please, I'm waiting for your answers. Children? Confused, right? Okay, I'll teach you. So first is loss of privileges. What is meant by loss of privileges? As you all know, the person in the organization will work with lot of privileges. As the days goes, as the days pass, when they are becoming promoted, there will be lot of privileges like salary privileges and promotions or any kind of improvement in their particular organization from the particular level to the higher level. We term it as some privileges they are giving, which means certain authority the person is getting in that particular organization. Loss of privileges, ultimately they will do, it is a big kind of delivery, which it is a good kind of input which we give to the employee. So when there is a serious form of misconduct, ultimately it will be a good penalty. So loss of privileges will not be the option. Demotion, when the person is yet to be promoted to the higher level, but we are not promoting him because of his misconduct, it will happen. Yes, demotion is also it is also a major penalty, right? So we are rejecting it also. Transfer. For what purpose transfer is done? Transfer is done for the well-being of the employee or to change the organizational behavior, right? So for example, if the employee is not feeling comfort, for that purpose also we will be we'll be changing, we'll be transferring the employees to the other department, or the organizational behavior, the communication gap or communication is not well within that particular department, this employee is cornered or something like that, we will be transferring that employee to the other department. So this is completely based upon the employee's perspective, where they actually need, and it is not a serious kind of penalty. So the correct answer will be your C. On the other hand, withholding increments, as I said, even loss of privileges also, it is also withholding increments when there is a hike in the salary, or with periodic performance appraisals, when the patient when the particular employee is having a hike in the salary, this will be lost. So this is also one of the kind of major penalty. At the end of the day, we always work for salary, right? When the salary is withholded or the increment is withholded, it is a serious kind of penalty. So the correct answer will be your transfer. Transfer will be your correct answer, right? Shall we go to the next question? Yes. Okay. So a temporary placement, remember the term temporary placement, of a nurse in the ward for just 12 hours or less than that, which is done to cover the shortage of nurse. Okay, which is done to cover the shortage of nurse for just pull through or something, you will be telling like, for that particular shift, there is a shortage of nurse in my unit, so I am just sending my staff as a nurse leader, right? Especially during evening and night shifts by the superior person is called, or supervisor is called. So always remember, to attempt this question, you have to know about the basic terminologies. What is this interdepartmental, intra-departmental, interlocation, and short-term deployment, right? So let's start. Okay, what is intra-departmental deployment? First, remember intra-departmental deployment. Intra-departmental deployment is nothing but, for example, if I'm working within the organization, right? So, for example, if I am a critical care unit nurse, or you can take a coronary care unit nurse, intra-departmental is like that. The nurse is shifted to completely another department. No, it is not completely another department. It is the department within that. For example, in intensive coronary care units, we also have HDU, right? High density unit, where the patient is so critical, will be put into the critical care unit, which means the coronary care unit. And when the patient is becoming quite stable, we will be shifting the patient into HDU, right? HDU. We'll be shifting the patient to the HDU. So critical care unit is like where the patient is so critical, we are admitted there. When the patient is becoming somehow stable, we are transferring the patient to the high density unit. So this is the thing. When there is a shortage between this, or when there is a lot of pooling of staff, so what we will do is we will be shifting within the department. This is, just remember, within the department, if you are working. That's great. So within the department, which means within the department. Just give me 1 minute. Yes. So what we are doing is, within the department, we are shifting the person or the employees, that we term it as intra-departmental, within the department. For example, I'm a critical care unit nurse of coronary care unit. I'm just shifting to the same cardiology department of the high density care unit. That is your intra-departmental. On the other hand, we have interdepartmental. Interdepartmental is something which is very different. I am a nurse working in a critical care unit, and I am shifted to NICU, which is not completely my department. It is a totally different department. That is your interdepartment. You know about this interdepartmental college fest or intra-departmental college fest. This is the term. Okay. So intra-department is completely within the particular unit. For example, in the department, cardiology critical care unit is there, and the cardiology intensive care unit is there. Within that, I am shifting the staff. Okay. Within this, it is happening. In this, what is happening is, with totally to the another department. From the critical care unit, I am shifting that particular staff to the NICU, which is totally in another department, right? So that is termed as your interdepartmental deployment. What is interlocation department? For example, there is a big corporate hospital, okay, and the corporate hospital is running an rural health center or a primary health center in the another location, which is very far away from the hospital. So that is termed as your interlocation. So PHC. In some PHC, the staff is shifted. So that is termed as interlocation deployment. Interlocation deployment. Short-term deployment is a term which is mostly relating to your 12-hour shift, which means just for a particular period of time to the any department, the staff is assigned to any other department, which we term it as short-term deployment. Yes, the correct answer will be your D. That is short-term deployment is completely, which is including like for the particular only just for 12 hours, the particular staff is allocated to this particular department. It may be any department. That is your short-term deployment. Okay, clear. So remember, intra-departmental is within the department, which means in the cardiology department and so I'm shifting the staffs. Interdepartmental is like completely to the another department. From cardiology, I'm shifting the staff to neonatology. That is your interdepartmental. On the other hand, we have interlocation deployment, which means completely changing the location of the staff nurse. Sorry, nursing officer. So completely changing the location of the nursing officer is termed as your interlocation department. On the other hand, we have short-term deployment. Short-term deployment is for particular shift. Either it is a 12-hour shift, it is a 6-hour shift, or whatever it is. Just we are putting the staff in the another department. We term it as short-term deployment. So ultimately, the correct answer for this question will be your short-term deployment. Is that clear? Yes. So the next question. Here it is very, very important question. Please understand the question so that you can able to analyze the questions. You can answer the questions of ABCD analysis, VED analysis, XYZ analysis and all, right? So I said the answer before, right? All of the following techniques of the inventory control, all of the following are techniques of inventory control, except. Yes, you just put the answer in the chat box, dear students. Please, I need your answers in the chat box. Please, why the chat box is so vague? Yes, please answer the question. Please answer, please answer, please answer. I need answer. This is the most aware questions, like you read a lot of questions and a lot of important questions which comes in your management examinations as well. So I need your answers, definitely. Which of the following? It is very easy. It is just rejecting the possible and what is the correct answer. Yes, children, please. I'm waiting for your answers in the chat box. No answers. Why? Yes, please put your answers. Either it is A, B, C, or D. Are you all in the online? No answers? Not sure? Yes, you make really a very less concentration on management and education. This is shown in this. Okay, let me teach you what is the concept behind this question is. All of the techniques are following in the inventory control except. So ABCD analysis, you all know this ABC analysis, which is a very, very important analysis which we do. And it is in the process of your inventory control. Yes, it do have. Next, we have VED analysis. Yes, VED analysis is also one of the important analysis we do in management of our inventory and control over the inventory we do. Yes. On the other hand, we have XYZ analysis. Yes, XYZ analysis also we are having in the management of nursing and even management of any kind of business administrations. So SDX analysis is also like XYZ analysis is also available. SDX analysis is something which is not at all related to the nursing management or any kind of managerial techniques in inventory control. So the correct answer will be SDX. So for approaching the other concepts of ABCD, VED and XYZ, let's have a detailed discussion. Okay. So first is your ABC analysis. What does mean by ABC analysis? All these analysis, all these techniques are generally used to identify the proper inventory control or inventory management of the particular organization. So for example, I'm telling what is ABC analysis. Let's start with ABC analysis. Yes, very good. Bandaru, very good, very good. SDX is the correct answer. Very good boy, very good boy. And let's discuss about what is ABC analysis. Okay, ABC analysis is expensive inventory, which means the A-level products, which should be had accurate control requirement. For example, if you take the high-end emergency medications or high-end antibiotics, which are so expensive, and the accurate management of the control over that particular products is so much necessary. When it is not in a complete controlled manner of product, and there will be a lot of poor management and loss of money and product and everything will happen. So in order to reduce this, the expensive, like ABC analysis, you just remember a term, it is completely a value-based inventory system. Okay, value means what? It is based upon the value. It is completely based upon the value. Okay, so for example, according to the cost, according to the money of that particular product, the ABC analysis is characterized. Okay, the category A is for expensive products, which need the most accurate control over the requirement. For example, you can take the high-end antibiotics. On the other hand, we have moderate value inventory, which means not that much expensive, but quite expensive. So these are moderate value inventory, and moderate control requirement is necessary. And next, on the third hand, we have this low cost inventories and minimal control over. For example, if you take these gloves, hand washes, certain equipments, which are very low cost, and their movement within the organization is also higher. So the minimum control over the requirement is placed. So ABC analysis is generally for value based. A is most expensive, B is moderate expensive, and C is low cost. Expensive inventory, moderate value inventory, and low cost inventory, C. So this is all about your ABC analysis. Always remember, ABC analysis is completely for your value-based analysis. Next, we have this VED analysis. VED analysis is specifically about the criticality. What does it mean by criticality? Criticality means how much that particular product is essential in functioning of that particular organization. So in hospitals, we have various products. Okay, so here we are analyzing and categorizing based upon its criticality. Without that particular product, I cannot run a hospital. Without this particular product, I can able to manage the organization, manage the hospital. This is not necessary, but even after some time if the product arrives, it is okay for me. So like that, we are analyzing the products, analyzing the inventory according to their importance in day-to-day organization, day-to-day hospital functioning. That is termed as criticality. So ABC is always value-based and VED is always... Yes, I'm explaining each and every analysis. Okay, so VED analysis is for criticality. Criticality is the concept which means how much this product is essential in performing today's task. Or today, if the hospital has to run, this product is so vital. Okay, and so for example, first is vital. VED first is vital, E for essential, and D for desirable. So V is vital. Would cause a major disruption if they were run out of stock. So just give me an example, what product can come under vital inventory under VED analysis? For example, if you take this critical care medications or emergency drugs such as ADR, atropine, dopa, dobuta, lidocaine, and all, these are most vital components. If suddenly the patient is on emergency situation, these are life-saving drugs, which is more vital, and without that, we cannot run a hospital, right? So that comes under vital. On the other hand, we have essential, important to the business operations, but it is not so much critical when compared to the vital products. Okay, certain utilities which is so much essential, but it is not that much critical enough as like vital. And desirable, it is not essential for business operation, but they are still important. For example, any kind of stationaries or something like that, which is desirable, which is so mandatory. And if it is not present also, we could able to manage those things. So that is about VED analysis. Always remember ABC analysis. Please zoom in the slide. Okay, dear. So always remember VED analysis. First, I'll show you the ABC analysis. Always remember ABC analysis is working on the value. Okay, value. Always remember it is based upon the cost of the product. Okay, ABC is working under the process of cost-based inventory. You remember in that way. That is, A is expensive inventory, which is accurate control you have to maintain always. B is moderate value inventory, which is moderate control over the requirement you will be analyzing and you will be keeping the notes. And C is very low cost inventory, which has a very, very minimum amount of control over or held by the particular nursing staff. Next, we have VED analysis. VED analysis is basically upon the criticality, which is how much important is that particular product to perform that particular task or to for the day, for that particular work, for that particular day, for that particular work. I need this product definitely. For example, the emergency drugs. So these are more vital. So vital, the sense would cause a major disruption when they run out, right? For example, emergency medications, I said you. V for vital, E for essential. Essential is important, but it is not so much critical as compared to your vital component. Okay. And desirable, it is not essential for business operation, but it is also playing a very, very minimal important role. And still we can able to manage with that desirable inventory as well. So this is all about ABC and VED analysis. Next, we go into the XYZ analysis. So what is XYZ analysis? XYZ analysis works on how much you people, do we have any? Yes. XYZ analysis always worked on the demand. Okay, how much demand I have for that particular product. Okay, and X is categorized as your predictable demand. Y is categorized as your fluctuating demand. And Z is categorized as high demand or highly erratic demand. S is X items is your predictable demand, which means for running that particular OT for this 1 week, I need this much amount of OT, like personal protective equipments. That is predictable. And this much of surgery is planned for this particular week, and this much of personal protective equipments is needed for that particular performance of the particular procedure. So this is predictable. On the other hand, we have Y. Y is fluctuating demands, which does not have that much control. Like sometimes the product may have increased amount of necessity, or sometimes the product will not be having that much amount of necessity, like very, very decreased amount of necessity. Sometimes the product is not at all needed at all. So it is like fluctuating up and down requirement of the products. So that is your fluctuating. Y items comes under fluctuating. And Z items at the end, we have this highly erratic demands. What is meant by highly erratic demands? Highly erratic demands is which means these will also always be having it always require, like most of the products is always required. We cannot predict the requirement of that particular product. For example, if you take this emergency medications, we cannot predict, but always there will be a demand for that such particular medications in the critical care unit. So that we term it as highly erratic demands. X is predictable demands, which means somehow I able to capable in maintaining. So somehow I able to manage predictable demands is something like somehow I able to analyze how much is this particular product is necessary to functioning of this particular event or particular month, how much OT equipment is needed. I can able to predict and I can able to put it. Fluctuating is highly fluctuating, which means the importance of that particular product may decrease or it might be increased. So fluctuating is Y items. Z items is always highly erratic demands. Always there will be high amount of demands to that particular product. For example, you can take this emergency medications. So while we have a quick review on this ABC, VED and XYZ analysis. Okay, ABC is completely based upon the value. Okay, always you remember it is based upon the value. A is expensive, B is moderate expensive, and C is very low cost inventory. A, we will be having very accurate control over the inventory. B, you will be having very moderate control. And C, you will be having very minimal control over the equipments. It is a value-based inventory. Next, we have VED analysis. VED is your vital, essential, and desirable based upon the criticality. Criticality is the important term here. Criticality doesn't how much important that particular product in the day-to-day function and structure of that particular organization. For example, how much important those medication inventory to be maintained. Everyday demands. As per the everyday demands, it is working. So that is VED analysis. VED is your vital. Vital is something which would cause a major disruption if they run out of stock. Essential is something important to the business operation, but it is not so much critical. So that is essential products. Desirable is if the product is there, or if it is not, it is manageable with for few days. That is the concept between this VED analysis. XYZ is based upon the demand. Always you remember XYZ analysis is always based upon the demand of the particular products. Demand is predictable. X is predictable and Y is fluctuating demands and Z is highly erratic demands. So which of the particular thing which is not under inventory control? SDX is nowhere under the inventory control. So XDX is the wrong answer. So XDX is the correct answer. According to the inventory, it is a wrong answer. Okay. Yes. Next question. Shall we start the next question? Yes. When one chooses a course of action from several options based on a criterion, one choose course of action from several options. Here, the key term is several options. Several options are available. Out of that, based upon the criteria, based upon the regulation of the institution and professional standards, I'm choosing one, only one. When one chooses a course of action from several other options. What is the answer? Please tell me. It is a very, very easy question. Please answer me. Children, please put your answers. I'm waiting. Active students, energetic students who really have a brainstorming capability can able to answer these questions. I want students to answer this. Yes, I'm waiting for your answer, dear students. Please put your answers in the chat box. Who is really so critical thinker, they can able to answer this question. Very good, Aishwarya, very good. It is decision making. Very good. Whenever you're choosing only one option with when the several options are available in that, you're choosing the best option. That is termed as decision making. So the decision making is the correct answer here. Whenever you have lot of options, lot of suggestions, lot of things at the end, you will be choosing only one that is based upon your decision making capacity. That is termed as decision making. Very good, Sayali, very good. It is the correct answer is B. Right. Based upon like that also decision making is for your personal decisions you can make as if you want. But when you are working in a particular organization, when you are on the superior most person, obviously within few days you will be becoming a nursing officer in names, and after 3 or 5 years you will be becoming a supervisor or in charge or whatever. All the best for your future endeavors like that. In that process, you will be actually put into the situation of decision making, right? So there you have to know, while there is available of n number of options, which is the best option, which is the most suitable, and you will be choosing that particular option also based upon what? Based upon the regulations, rules and regulations of the organization, according to the professional standard and demand of the particular organization, you will be choosing the best decision. That is decision making in nursing management. Why we are rejecting other options? What is problem solving? Problem solving is generally when we get a problem, when we get a challenge, we are minimally making some actions to solve that particular issue. Okay. For example, there is a lot of nursing shortage. Okay. There is a lot of nursing shortage in the organization, and the people who are working under this people are working under this organization, especially the nursing officer, are so hectic. And what is the problem solving capacity? Immediately we have to do the recruitment. Okay, proper recruitment and recruiting more number of staffs. This is the problem solving. But decision making is something like from the higher authority, they have to make some important decisions where they can give why there is a shortage, analyzing why there is a shortage, and we have to make particular decisions according to that. Like which means because of a low pay, There is no people who are coming forward to work in the organization. So those kind of things has to be monitored and proper decision has to be made to solve those things. Diagnostic reasoning is something like under various available solutions, you are picking up the best solution is termed as diagnostic reasoning, which means variable solutions or so n number of solutions you have available. Okay. Decision making is action. Okay. Decision making is action. Don't confuse it. Diagnostic reasoning is solution. Among various solutions, you are choosing one particular solution which will be most appropriate for that particular. Hypothesizing a solution, which is a very common term which is used in research, which means predictability, which means how much this possible thing can happen, how much this it may be negative or it may be positive. That is hypothesizing a solution. The solutions which we are making, it may give a positive outcome or it may give a negative outcome or it may give a neutral outcome. That is hypothesizing a solution. Whenever you choose one particular option from several options, that we term it as always based upon the criteria, institutional policy and all, that is decision making. Right? Shall we go to the next question? Okay. What is the highest level of growth needs as per Maslow's hierarchy of need theory? This is also a ESI repeated question. So just tell me what is the answer. I'm waiting for you in the chat box. What is the highest? Yes. Yes, I'm waiting for your answers, dear. It is very easy. Yes, yes, yes. Answers, please. Dear children. And even you have attained that particular. Very good. Aishwarya. Aishwarya is so powerful and she's so talented. She's immediately answering. Very good, very good. So proud of you and all the best as well. So highest level of growth needs as per Maslow's hierarchy is always self-actualization. You have to know about Maslow's hierarchy of needs because it is a very important. When you go for MSc, even when you go for PhD, this question is very important for you, right? The correct answer is C. So here, this particular component or this particular hierarchical diagram, which is termed as Maslow's hierarchy of needs or Maslow's hierarchy of basic needs. Okay, so this is termed as basic needs. So here, Maslow is defining this concept as when the individual is coming with the first level of, when they are achieving the first level, they will go to second level. When they are achieving the second level, they would go to third level. Like that, it is defined. For example, first is physiological needs. For example, the major important needs, basic need of a human is air, water, shelter, and food. So when he is achieving that particular that particular things, then he will go for safety needs, personal security, building a house for him, employing, allocating resources, buying resources, and all will come under safety needs. Love and belongings. Once he is settled, once you got a job in NORCET examination and cleared everything, and you are just set to go for a good future, you will be going for your identifying your best partner. Love and belongings, like you will be getting married, sense of family, sense of connection within those things. Then esteem. Esteem is like when you have everything which you needed, which is demanded by the society. At last, you will be having the good self-esteem. You will be having a status and a good recognition in the society. That is your esteem. Next is self-actualization. You have satisfied all the social needs. At the end, you want to achieve, like you want to make some time for you. You have some personal desires and goals which you are craving to attain. That is termed as self-actualization. When you nowhere stopped, like becoming a nursing officer in AIMS, and you're again coming up with any entrepreneurial ideas or any startups from your end. So that is termed as self-actualization. So as the diagram parameter implies, the highest level of attainment in Maslow's hierarchy is your self-actualization. Starting from physiology is your first, safety and needs is your second, third is your love and belongings, fourth is your esteem, and fifth is your self-actualization. Okay, shall we go to the next question? So the answer is self-actualization. What is aestheticness? Aestheticness, when we go to a hotel, wow, this hotel is looking so aesthetic. or when you see a beautiful girl or a beautiful boy, this boy is looking so aesthetic. Aesthetic is the component which is completely describing a beauty of that particular person or place. It is not anywhere related to the Maslow's hierarchy. Cognitive. Cognitive is cognitive thinking, thinking beyond, breaking boundaries. That is cognitive thinking, which is a critical thinking or ability, the ability to grasp certain concepts. That is cognition. Esteem. Yes, some people have answered C also. Esteem is just below self-actualization. Just remember, esteem is not the highest level. Esteem is just below self-actualization. Always remember, self-actualization is the major or the first highest priority, highest level of your master's hierarchy. Clear? Esteem is fourth, and more than that, self-actualization. Is that clear, my children? Yes. Next, we are going to the next question. So which one of the following tool maintained by the teacher is valued for assessment or student performance? Following tool, teacher is very valuable for assessment of students' performance. Teacher is very valuable for assessment for student performance. Once you become a teacher, you will not be reading about this. Okay. So when I started learning about anecdotal records, so whenever a teacher is maintaining a proper record of assessment of the students' performance, okay, performance, progress, behavior, everything we record. As a class teacher, I will sit and record. Abhinand is a student. Abhinand is good. Abhinand is very progressive. He is very talented. If I'm maintaining a record, which means it is a valuable assessment term. And we also have like certain organizations in the foreign, or certain when you are placed in a very high-end organization, they are even asking the data of anecdotal records. Anecdotal records it is not only having your marks and all, it is having your behavior. What is your behavior within the particular campus? What is your progress in education? What is your progress in behavior? Everything, even your disciplineless activity, your disciplineful activity, your achievements, your performance, everything will be recorded from A to Z in anecdotal records. So the correct answer is anecdotal records. Anecdotal records is a tool which is maintained by the teacher as a valuable assessment of the student performance. Here it is specifically given at performance. It is not only identifying the performance, the progress of the students, the behavioral aspects, everything is recorded in the anecdotal record. From the day one you are getting an admission, your class coordinator will be filling this particular student in this way. The behavior of the student, everything. This term, you just understand this concept. If that is the concept in the question, you have to go and choose without any confusions. You have to go and choose anecdotal records. And next, incident records. You always know incident records. People working in, or whenever any unhealthy or non-maleficence of kind of incident happens, we will be writing an incident record. Self-report is not like record. Self-report is like what you write about yourself, which means self-analysis, self-regulation, self-made values and morals, and what is you actually, your self-esteem actually, you're writing a report on that comes under your self-reports. And on the other hand, clinical attendance, yes, clinical attendance is completely which is relating to your present and absent in the clinical area, whether you just absconded or you're present, or those things are under your clinical attendance, right? Yes. So the correct answer will be anecdotal records. Always remember, anecdotal record is also a very, very important question and expected question, because whenever a teacher is maintaining any kind of large records, which is compiling of all the informations regarding the student, that is termed as anecdotal records. Is that clear, children? Yes. So next, the overall plan of rotation of all students in educational institutes, including teaching, learning activities, and related events in the academic year, is known as the overall plan of rotation of all students in the educational institution, including teaching, learning, clinical, everything, and related events during academic year is known as. Always, what you will do as a student, you simply download the clinical rotation plan. Okay, I have to go to this clinical area. So you will be always concentrating on the clinical rotation plan. And you will, what you will do? Then you will directly go and click the answer. Clinical rotation plan is the right answer. What is the right answer here? Please answer. Curriculum planning. Curriculum planning, master rotation plan. Yes, very good. Master rotation plan is answer. Correct answer. Like people, Bandaru and Sayali has answered it. So correct. Very good. So it is your master rotation plan. Always remember, you just exposed to clinical rotation plan so that you should not go to click the clinical rotation plan. Master rotation plan, which contains all aspects, which means when is your vacation, going from which you people like, going from your vacation, when is your vacation, when is your clinical posting, when is your theory classes, everything, each and everything will be there in your master rotation plan. Okay, starting from your clinical theory practices, leaves, everything, you're off, and everything will be included in your master rotation plan. So all the activities, the overall activity of the student is planned periodically by the teacher. So that is termed as your master rotation plan. The correct answer is master rotation plan. Clinical rotation plan is so compact that it contains only the clinical posting allocations of the students. Curriculum planning, and it is very important for you to know about this curriculum planning and course planning, the differentiation. Curriculum. When we talk about curriculum is group of courses. Okay, curriculum is group of courses. For example, group of courses, the sense when we talk about nursing, nursing is a general term. In nursing, BSc, MSc, PhD, all these comes under curriculum. They are under one curriculum. They are under one branch. Course plan is something which is so specific. When we talk about, it is only a single course. Curriculum is group of courses. Courses is just a single course. For example, if I'm taking BSc nursing, under BSc nursing, first year, I'm taking anatomy and physiology. Under anatomy and physiology, what are the topics which I'm going to learn? What are the content I'm going to learn? That is your course plan. Okay. Course plan is always so specific. Curriculum is group of courses. Right. I hope I have given you a clear insight about this. Always remember, when there is a group of courses, planning their content development, what are the contents to be taught to the students, everything, it is your curriculum. When you talk about course plan, it is specifically or to the particular course, the particular subject. For anatomy and physiology, this is the content the student has to learn in the first year. This is course plan. Curriculum is for the whole BSc, the student has to learn top from anatomy and physiology to obstetric and gynecology. What are the things the student has to learn? That is your curriculum planning. Clear? Yes. Let's go to the next question. Consider the following. Shall I go a little bit fast, student? That is boring when I'm going so slow. Okay. Considering the following statement regarding OSCE, that is your objective structured clinical examination, which of the following statements given above are correct? Okay. So you have to identify, you have to keep in mind what is objective structured clinical examination, and you have to answer this question. It provides more emphasis on performance of skill. Just, I need the answer for this question also. Please put your answer in the chat box, dear students. Please be active. It provides more emphasis on performance of skill. It provides more useful in assessing the, it is more useful in assessing the knowledge of students. It requires checklist for evaluation. Holistic approach to patient management cannot be assessed. Yes, come up with the answers. Come up with the answers. Please, dear children. Yes. Yes. No answers. Okay, let me start. So first point, it provides more emphasis on performance of skill. OSCE examination, objective structured clinical examination is completely planned for skill assessment. How do you perform certain procedure? How did you perform competently certain procedure without even skipping any particular steps? Yes, it is correct then. It provides more emphasis in performance of skills. Yes, it is basically assessing your skill set. Next, it is more useful in assessing the knowledge of the student. In OSCE, we are nowhere talking about any knowledge. We are not asking any questions. The student is just performing the procedure. Based upon the performance, I'll be having a checklist and I will be giving, for example, I'm analyzing intravenous cannulation. Okay, that is the procedure for your today's OSCE station. What I will do is I'll be sitting with the checklist with all the procedures, starting from the hand washing until to the end hand washing. I'll be having all the particular steps. If the student is performing each and every step only, I'll be giving marks. 1, yes, it is done. Yes, it is done. And at the end, I'll be putting the marks. Right. That is the checklist. At the end, I'll be putting the end mark of the students, 15 out of 15 or whatever. Okay. So that is the thing. So knowledge is not assessed because I'm not asking any questions. I'm observing the skill and competency of the student. It requires checklist for evaluation. Yes, ultimately, that is the second point which I said to you. Holistic approach to the patient management cannot be assessed. Yes, it is just assessing the skill and competency. Holistic approaches like counseling, guidance, all aspects, physical, emotional, psychological support, everything cannot be assessed through OSCE. Only your skill set is assessed. So that is very important, right? So your correct answer will be 1, 3, and 4. You are rejecting knowledge of students, right? So the correct answer will be your 1, 3, and 4. Okay, I'll have a detailed discussion about OSCE and clinical examination at the end of the session with a short table. Okay, I'll teach you. So next question. The chart indicating the distribution of questions based on the objects and contents area is called. What is that? Chart indicating. Yes, unless you become a teacher, you will not be aware of this also. Yes, tell me children, what is the answer for this? Chart indicating the distribution of question based on objectives. Yes, I'm waiting for your answers. Yes, Aishwarya, can you answer this question? Bandaru, Sayali, all answer these questions, dears. What about the other students? They are so idle. Yes, yes, yes. I need the answers. Basically, what is the chart indicating the distribution of questions based on the objectives of the content area? Yes, the answers is not received till now. Not that much clear. Okay. Always remember a chart indicating distribution of questions. Distribution of questions. Distribution of questions based on the objectives and contents. Before planning a course plan, before planning a curriculum plan, the teacher will also plan this also. Okay. For example, the first unit is having 30 hours because it has a higher weightage. So what happened? The weightage of the probability of the question asked from that particular unit will be also higher. Okay. So for that, we will be creating a blueprint based upon the course plan. So blueprint is something like, for example, this is the thing. Unit 1, 2, 3, just 4, 5. Unit 1 is having 10 hours. Unit 2 is having 20 hours. Again, 10 hours, 30 hours, and 10 hours. Like that it is having. So what I will do is, for example, 2 marks, 5 marks, and 10 marks. Okay, it will be classified like this. So what happened? I will plot according to the requirement. For example, first unit is having 10 hours, which is having a minimal importance. So what I will do is I will just either give a 2 mark here or either a 5 mark. In second unit, it has 20 hours and it is a major unit. So what I will do, either I will give a 10 mark and I will give a 2 mark from that unit, which means the probability of asking the question from that particular unit. Like the unit is given more importance, more hours of teaching, so that the more questions will be possible to come from that unit. So that is the concept behind this. And in third unit, it is again 10 hours. Based upon the probability, either I will give 2 marks or 5 marks to that particular questions. Okay, 30 hours, the fourth unit is having 30 hours. So what I will do, I will give a 2 mark, I will give a 5 mark, and I will also give a 10 mark in that unit. And again, in the fifth unit, it is just, I'll give either 2 mark or 5 mark. So based upon this categorization of the questions, probability to the examination is put as a chart, as a framework, which is always termed as your blueprint, which means the probability of the question which is possible to come under that particular concept. Yes. Thank you so much, dears. Thank you so much. See, I was not seeing the chat. Okay, sorry. So you have given various answer. B is the correct answer. Sayali is correct. Blueprint is the correct answer. So according to the probability, I am dividing the questions based upon the content and objective of that particular course. So that is blueprint. So this is blueprint. I think I have given a great info about it. And question paper is all like it is a general question paper which you have long answers, short answers, MCQs, and all. And question bank, on the other hand, what is my question bank? It is a pool of questions, which means like you'll be having thousands of 10-mark questions, thousands of MCQs, thousands of short answer questions from which you can make a guide to learn for your prepare for your examination. Checklist is the component. We can use checklist for various options for assessing the competency, as I discussed during the ASCII session, or any kind of procedures or anything that is termed as checklist. So it is nowhere relating to the question. So distribution of questions based on the objective and content is always your blueprint. Okay, just keep that in mind. Blueprint is something which is relating to your distribution of questions or probability of questions. There is a lot of chances that the 10 mark will be from your fourth unit like this, right? So that is blueprint. Next question. Which of the following core critical thinking skills related to monitoring and correcting mistakes occurring in the process of interpretation, analyzing, interfering, evaluating, or explaining? What is the following core critical thinking? Yes, tell me, dear children. Core critical thinking skill related to monitoring, correcting mistakes occurring in the process of interpretation, analysis, interfering, evaluation, and explaining. Yes. I have showed the answer also. Yes, tell me. What is the answer? What is the answer? What is the answer? Which of the following is a core critical thinking relates? So just remember, we are talking about core critical thinking process skill, which is relating to monitoring, correcting mistakes occurring in the process of interpretation, analysis, and interpreting, evaluating and or explaining. This is completely term which is indicating your self-regulation, right? What is meant by self-regulation? It is your own perspective of own thinking, own skill, according to your own skill, internal factor, okay, internal aspect. You always try to make some sense in interpretation, analyzing, and interfering and evaluating certain concept or certain technique or whatever it is based upon yourself. Please, oh, bilingual languages, English. Sorry, dear children. I want to tell you that I am a South Indian. Okay, so I'm learning Hindi. Hope I'll in future classes I'll make classes in Hindi as well. So just tolerate me. I'll be very slow for you to make it so understand. And whenever you have any doubts, you can put a message to me so that I can make you clear the concept. Okay. So sorry, I cannot talk in English. And this session is also an English session as well. Right. Okay. Okay, dear. Okay, Balveer. Okay. Oh, it is not possible because I'm quite bad in English, Hindi as well. Okay. So whenever you have any doubt, just put the message in the chat box. I can able to communicate with you. Okay. In a very slow and very like understandable English. Okay. 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 So self-regulation is own skill, which means my own perspective. Like I am interpreted when I'm put into certain problems or when I put into certain situations, I'm interpreting my own self. I'm analyzing. I'm interfering. So that is the concept which is completely inbuilt within myself, internal. So it is self-regulation. Why we are reacting? Why we are rejecting analysis? Analysis is from top to bottom, making decisions from various components are there. Like for example, in research, when we talk, what is meant by research analysis? Various categories were there, like demographic data, your tool, What is the intervention you're giving you to assess the effectiveness of the intervention? Like you have various components. Under that various components, you are analyzing the data. Analyzing, which means you're just compiling each and everything data. Compiling the data is termed as analysis. Okay, compiling any kind of data or any kind of information, that is termed as analysis. Interpretation is the end of analysis, which means what is the result, or it may be like what is interpreted, what is the finding, that is interpretation. Explanation is telling about the or teaching about that particular concept. Okay, explanation is completely conceptual, which is teaching. It is not directly involved with interpretation. Core critical thinking. Core critical thinking is you use your own perspectives to make certain decision. That is coming under your core critical thinking. Clear? So the answer of this question is your self-regulation. Okay. It's not what happened, Balveer? What question you are not able to understand is this? Okay, I will go for this question once again. Okay, which of the following core critical thinking? Core critical thinking, which means inbuilt. It is beyond, like everyone will be having critical thinking capability, but core critical thinking is something like you think out of box. I'm a person, okay, who is thinking in multispectorial aspects. I have various questions, various question marks. Okay, among that, I'm choosing the best one. Okay, and related to monitoring and correcting mistakes. By mistakes, my process, my interpretation, how I'm correcting it. So it is completely based upon self-regulation. It is based upon me. It is not about analysis, interpretation, or explanation. It is always based upon me. Okay, whatever decisions may which I have. Okay. So next question is the type of evaluation that compares the student's performance with others in. So please, students, this is a very, very important question. Please make a note of it. All four options is the MCQ, and it is an expected MCQ in your NORCET as well. So which is the type of evaluation that compares the student's performance with others in the same group? Is anyone is having a right answer for this question? Can anyone answer this question? People who are really good in nursing education can able to answer this question? Please, dears, please send me your answers. People who are really very good at nursing education can able to answer this question. C. Why C? Many people are answering C, formative assessment. Okay, children. Before approaching the question, let me give a detailed explanation of what is this. First, we have option A is criterion reference. Okay. Remember, criterion reference, remember the word criteria. Criteria, the sense, like, for example, I am a BSc nursing student. Okay. I'm a BSc nursing student. And once I complete the 4 years of course, I have an end examination. Or in that particular 4 years, these are the particular skills which I should be attaining. For example, you have to be well versed in all subjects, major subjects like medical, surgical, nursing, all the subjects, criteria. While evaluating a student, they'll be having certain criteria. To pass the BSc nursing examination, you might have passed all the 4 years university examination. So that is the criteria, which means you should get 75% of marks. In summative also I'm getting, yes, I'll give you the answer. First you listen the explanation without any hindrance so that you can able to answer this question at the end. Criteria, always remember there is always a criteria. Based upon that criteria only, they will be selecting you. Like they will be selecting you whether you are an appropriate candidate or not. For passing the BSc nursing examination, it is so mandatory for me to clear all the 4 years syllabus, all the examinations with the pass mark, with the pass percentage. Here, I'm no more comparing with anyone. Okay, here I personally, I have to get pass mark. So remember this example, I have to get pass mark. That is the criteria to get the BSc nursing degree. If I'm not getting a pass in any one of the subject, Management is not a difficult subject, yes. It is a very, very easy subject once you understand. When you develop a very, very good leadership capacity, a managerial skill, you will have that charismatic attitude of becoming a good nurse manager. And obviously, when you work in a central government institute, you should carry a good managerial skill, so which will uplift your image in the particular field. So just as out of topic, like criteria is for getting a BSc nursing degree, to get a gold medal or whatever, I have to pass in all the subjects. So here there is no comparison. Next is norm referencing. Norm referenced is norm-based lessons. People, like, for example, if I'm putting a ranking system, okay, for example, you take this ranking system, there is 100 students in the class. For example, your NORCET examination is your norm-based evaluation, norm-referenced evaluation. For example, many people are participating in the NORCET examination. More than how much? More than lakhs and lakhs of students are participating. And among that lakhs and lakhs of students, for example, the first mark is 75 percentage. So according to that 75 percentage, what will happen? The others rank will be categorized. Then the second rank will be 74, 73, 72, 71. Based upon the first student's mark, others will be either they will be selected or not will be evaluated, which is within the students, within the NORCET participants. Yes, B is the right answer. Anshika Sharma, very good. B is the right answer. Your NORCET examination is the biggest example for norm referencing, which means within the students, the evaluation is done. The first mark student will be deciding who is the last mark. Okay, so within the students, according to their mark, you will be getting into the exam. You'll be succeeded, or you'll be getting a job based upon the first mark, right? So that is the concept behind your norm-based referencing. Criterion is not like that. Criterion is that if the NORCET examination is happening, everyone who is getting 90% will be selected. That is criterion. There is no more interaction with the other students. Is that is clear what I'm telling you? 95%, whomever is getting 90%, they can enter into the NORCET, enter into the AIMS, they can get a job. That is criterion reference. Norm reference is the first student who is getting the highest mark, which is 75%. According to the 75%, the lowest mark will be categorized and the student will be selected. This comparison is happening between the student and student. So that is norm referencing. Formative and summative is very easy. Formative is whenever a teacher is coming, okay, for example, a management nursing teacher is coming, she's taking one unit and immediately she's taking one unit and immediately she is planning for one unit test. You'll be so irritated, no? So that is formative assessment. Now and there, every weekly, your sessional examination, your unit test, your MCQ test, everything comes under your formative evaluation. Summative is end examinations. What is end examinations? End examinations are your what? End examinations or your university examinations. That is summative, which is put in the is throughout the course. Yes, Taruna, you're very good. You're very so accurate that formative is throughout the course. We will be having various tests. That is your formative. In summative, it is end examination, which means at the end of that particular academic year, you have to clear that particular examination. For example, your university examination will be termed as end examination. I hope I have given you a clear insight. If you very good, Anshika Sharma, it's very good. It is at the end of examination. Very good. Formative and summative is very easy to understand, but norm and criteria will be new for you. So criteria is I'm having a specific criteria. If aims not set, if the students who are all getting 95%, they can get a job. They can get a job. That is what? Criterion based reference. Okay, that is criterion based evaluation. That is, if whomever is getting 95%, they are selected. That is criterion based. When we talk about norm based, within the students, there will be comparison. The first mark is, if the first mark is 75 or 85, based upon that, your ranks will be ordered. So that is your norm referencing. Hope it is clear, because it is very, very important topic. If you are clear, please give me a comment of that you are clear. Yes. or else if you need explanation, I will go for explanation. Please, children, so the question implies compare the student performance. Here, the student performance is compared in NORCET examination, right? So it is a norm-based evaluation system. Norm reference, norm-based evaluation, everything is same. There is no more. Criterion is setting a criteria that this or the following thing which has to be achieved. If it is achieved, the student is selected. If it is not achieved, the student is not selected. So that is the concept behind this. Clear? Yes, very good, very good, very good. Yes, next we will go to the next question. Which of the following are the purpose of audiovisual aids? It is also a very easy question. Please try to answer it, children. Someone is giving answer B. Yes, yes. For the previous question. Very good. Please repeat it once. Yes, I'll repeat it once. For Shreyash. Shreyash, I'll be repeating this concept once again because it is a very important concept. Everyone, please recall it. Criterion-based reference. I'll be slow. Criterion-based references. If I'm conducting, for example, I'm giving you the example of your NORCET examination. For example, every person who is securing 95% of marks in the NORCET examination can get into the AIMS, which means there is no defined number of vacancies. Whomever is getting 95%, they are selected. Okay, they are selected. That is criteria. I'm no more comparing your performance with any other students. I'm just telling if you get 95%, you are selected. So that is criteria. This is the criteria I'm setting. Every person who gets 95% and above, you will be selected. So this is criterion-based evaluation or criterion reference evaluation. Norm is something like it is actual pattern of your NORCET examination, which means the first mark is 75%. The first student who is getting the first, securing the most highest mark. For example, if it is 75%, based on the 75%, like it is a student comparison, right? Here we are not setting any criteria. Based upon the student's performance, the student who is getting the most highest mark, based upon that highest mark, I am categorizing the other ranks as well in percentile. So that is norm referencing what is actually happening in your NORCET examination. Is that is clear? Shreyash, you are clear about this norm referencing now? Yes. Norm is, I'm not setting any norm. My student is compared. Like, for example, to make it so simpler, if in section B, section A, there is 50 students, the 50 students I'm conducting a test. Okay, 35% is the 35 is the pass mark. That is your criterion reference. Norm referencing is who is the first mark, who is best performer, which means according to the student comparison, I'm telling the student who is securing 75 marks out of 100 is the first ranker. So it is norm referencing. So based upon the student's performance inside the classroom, I am giving the rank for that first mark student. So that is norm referencing. Yes, yes, very good. So formative is throughout the process of learning. Every day a teacher is keeping a test for you. Every week if a teacher is keeping a test for you. So that is formative. In summative, on the other hand, the end university examination, where you'll be so feared about what will happen, what question will come, everything you'll be thinking, no, that is your summative. So formative is throughout examination. Summative is end examination. For example, you can take your university examination. Very good, very good. So next question, I'm moving to the next question. Which of the following is the purpose of audiovisual aids? So there is a lot of chances you can get questions from audiovisual aids. Learn about the basic concepts which is governing about audiovisual aids. Now they are not putting, say the people who are taking the question paper are very clear. Now they are not putting the questions like from where, what is this 3D, three-dimensional, which is three-dimensional, which is four-dimensional, which is two-dimensional, which is one-dimensional. They are not putting questions like this. They just want to assess your cognitive and critical aspect, higher end aspect. So they are asking, what is the purpose? What is the use of this? If this is happening, what will happen? Like that, they have started putting questions. The students are answering. Very good. C is the correct answer. Let's see how it is a correct answer. So which of the following is the purpose of audiovisual aids? Which means AV aids. So to simplify the concept, yes, it is correct. The complex concept which is not understandable, the teacher will be putting it as a picture and she will be explaining, or they will be putting a picture in the PPT and she will be explaining, or they will be showing you a model of the heart to talk about the internal structure of the heart. So simplifying the concept. So that is termed as audiovisual aid. So it is ultimately making simplified, unfamiliar concept To bring about understanding where words fail. Yes, actually, whenever the words is always not so prominent to teach about certain criteria, so you will be going for this word. You'll be going for this any models or PPTs or videos or video graphics the teacher will be showing. To reinforce learning appealing to more than one sense. Already, as the name implies, is audio and visual. Audio is your hearing sense, and visual is your eye sense. So it is compiling two senses at the same time. To promote monotony, no, it will be no monotony. Why monotony? Monotony is just like that, blah blah blah. The putting the PPT and reading the PPT, blah 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 blah. It is monotony, right? So AV8s, when it is involved in the teaching process, it is nowhere provides any monotony. So the answer is yes, monotony will be resolved. Very good, very good, very good. Monotony will be resolved. You're on the correct track. So I hope you all will be clearing all the management related questions in this NORCET examination and coming and giving me with a good feedback. Okay. So next question. In the concept of simulation-based learning is also a very important topic under your education, which have high probability to have a questions from this end. So context of simulation-based learning in nursing, what does the term mollage refers to? Have you ever heard about this term mollage, dear children? If you have heard, please give me the correct answer in this following options. What does mean by mollage? Mollage refers to the use of mannequins in training. Many people are giving the answer A. So before answering the questions, I will show you the picture of mollage so that you can easily answer. I showed you the answer. It's okay. So this is the image of mollage. Okay, many people are answering A. So now you completely see about mollage. Mollage is the component like giving a real-time feel or real-time appearance on the simulator that the injury, application of suture material, really like showing the injury, head injury or any kind of burr hole or whatever. Real time you're showing that injuries happened. So you have to perform a dressing procedure in that. So the mannequin will be attached by these things. So now give me the correct answer. Yes, the application of realistic makeup on prosthetic to stimulate injuries or condition is termed as mollage. Always remember, the picture is so clear, which is depicting about here there is a stroma. Okay, stroma which is shown like real colostomy care you have to perform, just on the abdomen you cannot perform it so effectively. If I apply the sticker on the mannequin, it will be so useful for you to perform that procedure so easily, right? So that is your answer. Application of realistic makeup. Realistic makeup is your mollage, prosthetic to the simulation of the injury to the patient. Okay. Use of mannequins in training is used in simulation, but it is not specifically talking about mollage. The evaluation method of clinical skills. Yes, it is used in evaluation of clinical skills, but it is not specifically used to describe about mollage. Designing of interactive learning modules, which is not interacted with the questions as well. Yes, let's move to the next question. Just remember this image. This is mollage. Okay. Yes. Which of the following statement regarding the brainstorming method of teaching are correct? Yes, come on. To brainstorming. Why not C, the evaluation method of clinical skills? Here, they are just asking about, be specific with the question. They are just asking about what is mollage. They are not asking anything regarding what is simulation, what the simulation can give. So this is mollage. So it is a realistic makeup-like situation which is created on the mannequin to perform certain procedures to assess the competency of the students. So this is the thing. Okay. And here, please answer for this question. Which of the following statement regarding brainstorming method in teaching are correct? First is, it promotes critical thinking. Obviously, it promotes critical thinking. Next, it makes the students more skilled. Does it actually makes the student more skilled? We'll put in a query. Okay. To promote group activity, is that is anyway promoting group activity? We'll put in a query. Maximum ideas can be sought in short time. Yes, it can do. So now you have confusion between option 2 and 3, right? Yes, people are answering 1, 3, and 4. Yes, very good. It is 1, 3, and 4 is the correct answer. So when you have a slight confusion between, it makes student more skilled or it promotes group activity. Skill is nowhere assist in brainstorming concept. It is always a practicing of ideas and innovation which is spontaneously coming. Very good, children. Ramna, Preet, Tarun, and Shika, very good, very good. Your answers are so valuable to me. Very good, very good, very good. So your option C is the correct answer, right? So it promotes critical thinking. Yes, obviously you think out of box, breaking minds and cracking. What is the new thing? How can I innovate this thing? How can I draw? Like how can I draw? How can I explain this hard block so beautifully? Like that, you will be thinking, right? That is critical thinking process. Group activity. Sometimes it is an individual aspect, or sometimes you join in a group to perform certain procedure, certain brainstorming activity. That is a group activity as well. And maximum ideas, like in short period of time, you'll be keep on thinking, and maximal idea. Brainstorming can be performed in individual as well as it can be performed in group activity. During my college days, we always used to have group activity rather than individual activity. When it is group activity, the input which is given into the concept will be so higher. Okay. So when it is an individual activity, brainstorming is also possible in individual activity, Anshika. But here, to reject the distractors, to based upon the question, we are going for group activity. It promotes group activity as well. Like it promotes group activity in the sense when 4 or 5 people sitting around and thinking about same concept, each and everyone will come up with a new idea. Okay, so that what happened, the group cohesion will be improved. Okay, group quiz or something like that. Okay, yes, group quiz can be a good example as well. So we are rejecting skill. So 18th question is over. Consider the following statement regarding the preparation of multiple choice question. Unless you're becoming a teacher and creating short answer questions, MCQ questions, it will be quite difficult for you to approach this question, right? So what is meant by preparation of multiple choice questions? Yes, the stem should be clear. What is meant by a stem? See, this question is also very important. You have to identify. This is the stem of the question. Okay, this is the stem. The question which is actually given. Anshika, okay? The question which is actually given, that is the stem. This is the stem of this MCQ. Use negatives and double negatives? No. You should always have a positive. You should always have a positive answer comparing, and all others are your negative distractors. And you should not give a monotony or same kind of answers. So use of negatives and double negatives is not a component of making a proper multiple choice question. The alternative should be similar to length and detail and complexity. Yes. See, this. Many people should know, like as a teacher, when you are going to become a nurse educator as well. Yes, C is the very correct answer, dear children, Anshika and all. Yes, it is the correct answer, which means the alternative should be similar in length, which means, for example, if you take this question, see the length of the question. This fourth option is quite longer. It should not be like that. The ideal question should always be in the same length. Each and every options should be having the same length, which means it will create a lot of confusion to the students. Okay, that is one of the critical term in creating MCQs. Okay, each and like the stem should be clear. Like each and every options should be within that particular line. And regarding the detaility and complexity, each and every option should be having similar complexity so that only the student will be so confused to get the answer. This is the strategies that the competitive exams follow to confuse the students via the distractors. Everything in the same length, everything in the same monotony, like even the arrangements. For example, if there is any question which is relating to 2025 is the answer, they will give the options like 2026, 2027, 2028. They will not just like that. This is the synchronicity which will create a lot of confusion. They will not just give 2025 and without anything 2030, 2031. They will not give like that. They will choose to give like this because this will create a lot of distraction when comparing to that. Okay, so have to avoid using distractors that are essentially same. Yes, suppose you're not supposed to use same distractors in one question. So that the limitation, which means if there is one correct answer and 3 distractors, in that 3 distractors, 2 distractors are similar, the student will be able to easily answer between that 2. Correct. Does NORCET follow these while setting the question paper? Actually, it is not. Even in ESI exams, most of the questions which I'm discussing is today is also ESI examination questions. But like most of the competitive exams are not following these things. But these are ideal concepts which the teacher has to follow while preparing a MCQ as per book. As per the book, and it is also working on reality also. These same length of questions, same complexity, same detailing will create a lot of confusion to the students. When certain question is having a big explanation, right, you will think that it will be the answer. So NORCET and other competitive exam is not exactly following, but in most of the questions they are following. In some of the questions they are breaking these rules as well. Okay. So the next question is, which one of the following method is best for psychomotor skill development? It is a very, very easy question. I need your answer immediately. Psychomotor development, you just close your eyes and you have to go to for. Yes, tell me children. Psychomotor development, what is the answer? Fast, 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 fast. You have to go for lunch, no? Fast, fast, fast. Psychomotor development. Yes, yes, yes. Very good. Demonstration. You have to close your eyes. Anything which is talking about psychomotor development, you have to go for demonstration. Demonstration is the correct answer, where they will be assessing your soft skills, how you are pairing the gloves, how you are performing hand washing, does you follow all the particular steps in the performing that procedure. Everything, each and every concept is analyzed. That is your psychomotor concept is analyzed. So it is your demonstration. Lecture method is completely playing on your knowledge delivery, conceptual knowledge delivery, which I'm doing right now. Role play. Role play is your both psychodynamic and conceptual kind of learning, where like certain detailed concepts which needs a drama like feel, you can go for role play. For example, in community setups, we are using role play. No, role play. But no, it's not role play, dear. Role play is used in community setup where you will perform certain educational content related content and you will depict in front of to make the student to understand it easy or to make the public to understand certain important. If you're going and demonstrating and showing like you're performing a role play event on the community area regarding the proper hand hygienic technique, it is under role play. Demonstration to assess. Okay, best for assessing the psychomotor skill development is, now here I'm the key concept is I'm just assessing how the particular student is performing that skill psychomotorly, how, which means how they are doing that skill, how they are inserting the camera. I have to assess that, how it is developed, or does it need further. Yes, drug addiction, role plays, dramas, those and all comes under role play. Group discussion is group of people sitting together and discussing about the common topic and giving their own inputs. I come with another input, Taruna come with another input, and everyone will come with their inputs, right? So that is your group discussion. Okay. So psychomotor, close your eyes, go for demonstration. Okay. So next, which type of method used for developing teaching skills and competencies in teacher training? This is very important. Teacher training. Yes, just give me the answers. Even in your final year, you might have also have nursing education as a part of your curriculum. Very good. You might have added this micro teaching session where once you study this nursing education, you will become a nurse educator and you teach the class for 20 minutes, right? So that is the concept of micro teaching. Micro teaching is just 15 to 20 minutes session. Okay, 15 to 20 minutes session. The teacher will be evaluating the students teaching capability, teaching competency. So that is completely done through micro teaching only. I cannot sit for a seminar for 2 hours and I cannot analyze the teaching capability of the student. And lecture method is completely so beyond. I cannot expect a student to make a lot of like lecture will be going for more than 1 or 2 hours. So I cannot analyze anything within that. To analyze the competency of a teacher trainee, which means a student teacher, I will always utilize micro teaching as the best method. The best method is micro teaching. Seminar is 2 hours. It is so long. I cannot it needs a broader explanation of the concept, and lecture is also, it needs a broader explanation. So I cannot analyze the student with the help of this. These are utilized by the teachers to make. Group discussion, as I discussed you earlier, will not be the particular component which comes under. The individual teaching skill of a teacher trainee will be analyzed only by micro teaching. Real? Yes. A nurse leader wants to improve the job satisfaction and improve the job satisfaction and reduce the staff turnover in a nursing unit. Which leadership strategy would be more effective? Yes, tell me, student, what will be the answer? Yes, here the options. Ma'am, please explain the phases of micro teaching. Phases of micro teaching, I'll be teaching you later. So today we have to complete this MCQs. I'll teach you. Okay. And how many questions are there in total that had to be discussed? So we just have 29 questions, still more 8 questions is pending. I'll go fast, okay? Okay, the answer is C. Yes, very good, Aisha. Aisha, you're very good. Rampreet, you're very good. Like providing opportunity for professional development and career growth. See, for approaching these kind of question, you actually need your critical thinking. And you have to put yourself in the shoe of the particular nurse leader and you have to think what I have to do. When approaching certain options, you should be a nurse leader. So I hope, good. This Tarun and Aishwarya has given a great input in this question. So whenever I have to improve the job satisfaction and reduces the staff turnover the sense like they are leaving the job without any proper intimation or there is a lot of nurse shortage which is happening. What strategy as a leader I should use to improve this or to solve this problem is providing opportunities and professional development and career growth. Yes. So if I provide additional opportunities, additional remunerations, and if I give them a higher position, for example, I'm promoting them as a shift team leader, and I also teach them a lot of advanced procedures and expanding their knowledge. So those things comes under your professional development and all, and it always improve the job satisfaction of the particular staff nurse. Thereby, you will have the reduced dropouts. Dropouts is when you're not satisfied with that particular in charge, I'm going to resign the job. That's it. It is not like that. So for that particular problems, this is the solution. You have to improve the opportunity and all. Increasing the workload to challenge the staff. Yes, once you're going to increase the workload, again, the staff is going to tell bye-bye. And implementing a reward system based on performance. It also works, but the best strategy when comparing to all other options will be providing your opportunities and professional development growth rather than anything. Okay. Maintaining strict supervision, again, bye-bye. You're going to be so strict and keep on nagging the junior staffs, it should not do. As a nurse, I'm basically telling, when you become a nursing officer and when you become a senior staff, always support your junior people, teach your junior people. Don't nag them. Don't go and sit in the higher hierarchy that I am a TL. Now, whatever I tell you have to do. No, it's not like that. It's not a proper organizational behavior. Always carry out the attitude of passionate and respect each and every individual, even if it is your junior or if it is your senior or if it is a student nurse. Always respect them and give their space. Okay. So next question. So the nurse manager is using the 𝐸𝐴𝐻 chart, that is your situation background assessment recommendation, to communicate with the physician about the patient. What is the primary purpose? You always know about many people are know about this 𝐸𝐴𝐻 chart, which is used in the process of your handing over, which is making the minimally time consuming process, right? So the correct answer is B. Very good. Many people are coming forward with the correct answer. The structure communicate in clear, concise, and organized manner. The ultimate aim of 𝐸𝐴𝐻 chart is this. Like, I want to make a clear communication. During the shift, this was a vital signs of the patient. This was the procedure plan, and this was the procedure done. This was the medication the patient was taking, and this was the follow-up which has to be followed in your next shift. So like that, I'm critically analyzing and critically giving the solution to the students. So that is your communication is clear and concise. That is the ultimate aim and primary purpose of your 𝐸𝐴𝐻 chart. Okay. And to provide detailed narrative, there is no narrations. Everything is in a short and concise forms only. There is no narration, big paragraphs. It is not written like a nursing notes. To express personal opinion, no, there is nowhere we express any kind of personal opinion about the patient. To document the patient care in the medical record? No, it is not. It is not in the particular concept. So the ultimate purpose is to clear communication, concise and organized manner you are delivering. Okay. What is the primary purpose of using an objective? There we discussed about objective structured clinical examination. Here, objective structured practical examination in nursing education. So what is the answer? To assess the theoretical knowledge? No. To evaluate the student's performance in real life clinical experience? Is that we are giving real life clinical experience here? No, because it is not clinical. It is practical examination where you are giving mannequins to make the thing. It is objectively assess the practical skill and competencies using the standardized stations. Yes, with proper standardized station. Station 1, I have IV access, IV cannulation. Station 2, I have CPR to be performed. Station 3, I have to give guidance and counseling about HIV to the students, to the teacher. Sorry, to the patient. Okay, so this like we will be having various stations and you will be performing. To conduct group discussion in patient care, no. The correct answer is the objectively assess the practical skill and competencies using standardized station is the correct answer. Very good, very good. Practical skills, yes, very good, very good, very good. So this will detailedly show you what is the importance of this OSCE and OSPE and differentiation, so that it will be very easy for you to approach the questions when you get it from OSCE and OSPE. I'll be giving a very crisp and thing. First is OSCE. In OSCE, clinical skill, okay, focus of assessment, clinical skill, okay, including history taking, physical examination, communication, and decision making, everything which is relating to the clinical area. On the other hand, when we talk about OSPE, it is practical and technical skills such as procedural things, laboratory techniques, and use of advanced equipments. Those things will be coming under OSPE. Then scope is cognitive affective domain is used. The most common domain used in OSPE is psychomotor domain. Okay, like here I will be giving guidance and give the guidance and counseling to the guidance and counseling to the patients. I'll give you the PDF here. I'll give you this. I'll share this PPT with you all. Okay. Cognitive and affective domain to understand. Like, for example, I'm giving the guidance and counseling session for the HIV patient. I will be sitting as a teacher like this, and the student will be performing that procedure to the mannequin. Okay, they will be as if considering that particular patient is a HIV patient, and they will be start delivering the content. Okay, so that is the thing. And psychomotor domain is for the same patient start inserting a IV cannula. That is your psychomotor domain, which is coming under your OSPE. And structure of station often standardized patient like actors will be given. Here mostly we will be using mannequins, models, mollages and all. Okay. Evaluation assess both process and outcome of clinical interaction, including soft skills and effective communication is also analyzed in OSCE. There is when we talk about OSCE is something like your clinical practical examination which is happening. OSPE is something with the mannequins. Okay. So evaluating precision and accuracy in performing specific tasks, that is completely you are performing the procedure and analyzing your competency with the checklist. Tool uses checklist rating scale. Here also detailed checklist with each and every procedures will be used. Okay, like from hand washing to wearing the gloves in a proper technique, everything will be analyzed. Application in education. In medical, nursing, all where we are using OSCE only. And sometimes we are doing upgradation and we are doing OSPE also. OSPE is mostly applicable for laboratory-based technical training, which is also mandatory for nursing. You can add nursing also because we are also breaking the borders and going beyond and we are performing this also. Okay, so you have to go. And complexity of the station, this will be so complex, which means sometimes you put into a real life situation of the real patients and you are asked to assess, right? And here simpler and more focused, like at one station, only one task. If that station 1 is for CPR, only CPR I'm going to perform. Once the bell rings, I'm going to come out of the station. So that is the thing. So I'll give you this PDF. Okay, don't worry. What is the primary purpose of in-service education? The correct answer, to provide ongoing. And it is very important for you to know to differentiate about what is in-service education and continuing nursing education. Okay, I'll tell you. in-service education and continuing. This is also very, very, very important aspect. In-service education is always, remember, educating current staff, which means I am working in the particular organization. For example, I'm working in BLK hospital. BLK is conducting periodical educational sessions to improve the staff's competency every day. Every day there is a continuing nursing education programs. Sorry, not continuing in-service education programs. While I am in the service, my organization is conducting various educational programs. Continuing nursing education is nothing but you yourself take an advancement. Like I have to improve my knowledge. For example, attending conferences, workshops, and all that comes under continuing nursing education. How far you can improve your competency. For example, you're either whatever you're taking MLB Pro or Plan C plus what, these are all your continuing nursing education. Nowhere you learn a lot of concepts here, you are getting cleared everything, and it is ultimately improving your overall productivity and overall knowledge, right? Continuing education like MSc and then PhD. See, continuing education is not like MSc and PhD. MSc and PhD are advanced degrees. Continuing nursing education is, we can also tell that MSc and PhD are continuing nursing education, but continuing nursing education is not stopping. MSc is stopping within 2 years, but it is not stopping. It will be a lifelong learning. Continuing nursing education will be lifelong self-based learning. You will be attending workshops, seminars every day. If you want, you can attend seminars every day, webinars every day to constantly improve your knowledge day by day and becoming the most superior person in nursing, right? So that is the concept behind continuing nursing education. And even INC has certain criteria that when if your license wants to be active, you have to be participated in this much seminars, this much workshops, right? It is also having a criteria to improve the quality of continuing nursing education. The audience typically mandatory for all current nursing staffs, licensed nurses seeking maintaining for always who wants to maintain or enhance their skills, they will be given. Content focus on organizational policies, technologies, and important procedures and all. Here in continuing nursing education, always it is broad range of topics, including all clinical updates, up-to-date data, advancements, specialty area, professional development, all together it will be coming. What is the frequency? Regularly it will be happening, yes, in service education programs, every Thursday, every Friday, like that. It is ongoing throughout the nursing career. It is nowhere stop for continuing nursing education. Okay, just keep these points in mind. Mode of delivery on-site through workshops, seminars, hands-on sessions in the particular hospital within the organization itself. They are not allowing anyone outside from the organization to participate in their seminars or workshop. Okay, these are broader for all. Whomsoever want to participate in this conference or workshop, they can come and participate and they can work. Okay, they can study and they can get the knowledge and then get go. Example is any electronic health record training. Like I'm in my hospital, I'm implementing new electronic health records and information systems. Like that means I will be going for in-service education so that I will call all my staff nurses. I will teach them about this and they will be well trained about this. And from day 2, they will be start using that. If there is any practical challenges, again, I will be conducting another one in service education. Here, in continuing nursing education on advancing nursing practices, certification course, specialty area, updates, research, evidence-based practice, everything. Okay, that is coming under. Outcome, ensure the staff is becoming so competent within the current organization. In continuing nursing education, we have to make our license active. Apart from everything, when your knowledge wants to be updated, okay, you should have that personal instinct that I should do well, right? So that is the concept behind that. Next is improve the patient's safety and compliances with regulations and with the organization, okay? And enhances professional development and increases job opportunities. When I do advanced certification course, for example, I am a patent holder who had done a patent or medical innovation. So whenever I go to any kind of interview, I put forth the particular concept. So I'll easily get a job, right? So that is according to your competency, your opportunity for getting job is different, okay? A newly appointed nursing officer is posted in the neurological ICU Neurological ICU, it is a very, very easy question. What is the nurse-patient ratio in ICUs as per INC? It is always 1:1. And here I have you on advanced data. Always we remember in what setups, any kind of what setups, what is the nurse-patient ratio? What is the nurse-patient ratio and what setup, children? Please answer. It's 1:2. 1:2. Nurse-patient ratio in what setup? B is correct answer. In ICU, it is 1:1. In what setup, what is the answer? 1:6. Very good. Now, Tarun, all children, I'm putting you a question. When it is a specialized ward, like it is a neurology ward, okay, neurology ward, or it is a, uh, it is a, mm, it is a kind of cardiology, specific to cardiology, the patient with post pacemakers and all, if they are there. What is the nurse patient ratio then? Very good, very good. It is 1:4. When there is a specialized area in those conditions, in what setups, you should not supposed to go to 1:6. You have to go for 1:4. This is as per your INC criteria. What about OPDs? What about OPDs, dear children? OPDs? In reality always hits so different in nursing. We study a lot of things so different in theory. When it comes to practice, it is so different, right, children? So always when we compare, especially nursing with reality, it is a big gap between reality and actual happening. Deepak, you are thinking in my way. Yes, 1:10,000. See, jokes apart, but this is the INC. In exams, they are not going to ask about any reality. They are completely going to ask you about INC based criteria. So you have to remember this only. Yes, and what in OPDs, it is 1:100. What if they are giving the situation like they are giving there are two in a 200 patient OPD? What is the nurse patient ratio? Then you have to go for 2:100. Okay, 2:200 like that. For every 100 patients in the OPD, the nurse ratio will be increasing by 1. Okay, next question. According to Bixler criteria, which of the following is not considered as a characteristics of the profession? See, Bixler's and Bixler's wife, they are not actually nurses, but they had put forth lot of professional criteria and characteristics where the nursing student had nursing people has to follow. They had lot of love towards nursing profession and they have given certain criteria. Okay, so what is the following option which is not for coming under this Bixler criteria? People are aware about Bixler criteria, children? You are aware about Bixler criteria? If yes, please comment yes. Yes, very good. You are aware. I am so proud. Operates independently. Nursing is nowhere operating anywhere independently. We always govern with certain principles, ethics, codes, morals, and values. According to that only we are performing. We are nowhere performing with any kind of independent activity. Because if you even perform any single activity, the doctor, without my order, how can you perform? But children, you have to develop advanced level of knowledge and competency. Whenever you had a question like this, you should be possibly answer that question so boldly. You should not so dumb. When your mind is sound, you can talk boldly. Okay, so develop that attitude. Okay, so I will tell you about Bixler criteria. Also, these are Boilers and Bixler's criteria for profession. Well organized body of knowledge, like we have a proper INC based curriculum setup. These are the things which has to be learned in nursing field, and constantly enlarging the body. Frequently, we have revisions of our curriculum. Recently, we added this palliative nursing care and HIV based care and pathophysiology in our nursing curriculum. So constant body of the knowledge is increased. Entrust the education of the institution of higher learning. Enters the education to institution of higher learning. So we also have that higher level of educations like MSc Pro Masters program, nurse practitioners and critical care, PhD program and all, which is keep on constantly hiring our professional gradings. Ma'am, is it enough if for management, if we really on this session only? So I am not 100% sure if this is enough for you, but all the basic and important concepts is being covered. but you can also have a quick review on certain important key points and all. I advise you to go for a quick review, but most of the concept is cleared in this part. Okay. So if you want, you can advance your knowledge. You can also have a quick review as well. But all of the important points has been added in this year. Okay. And practical services are vital to human and social welfare. Yes. Wixler always concentrated that a profession should not always be so professional centric, which means if I'm a nurse, I should not be so selfish. I'm a nurse, my salary, my organization, my thing. It doesn't. Always a profession should create a social change, and it also supports the social aspects. So that is the concept behind this. Always you should have a social interaction and social well-being by your profession. So that is a function autonomously in formulation of professional policies. Yes, we have this autonomousity in perform professional policy making and deriving. Like when we talk about recently also a bill has been passed in central government regarding like these are the advancements which we need in nursing education and nursing practices. So according to that, the government will give certain policies to advance our nursing professions. Okay. Then attracts individual or intellectual persons. Now we have many entrance examinations for nursing examinations for getting admission in nursing college as well, right? Before and all, we doesn't have that. Now we make sure that only competent people, so knowledge people are getting admission for nursing college. Okay, strives to compensate by providing freedom of action, continuous professional growth, and economical security. I think this is not achieved that much in nursing, but we hope will do. When you get a central government job, it is achieved. But when you are a private sector, when you are in a private sector, this is not achieved that much. Okay. The economical security, job security is higher, but economical security is quite lower in private sectors. Okay. So this is all about your Wixler's criteria. So just go through. I'll be sharing you the PPT. This is one of the very, very important questions. Please note it, children. Which of the following principle management that emphasizes the importance of clear communication within the organization? You all know about Henry Fayol's 14 principles of management, right? So in that 14 principle, this following question comes under which principle? Which means a clear communication. B, unity in commands. Yes, still more understanding is needed. Any other answers, dear children? All are answering B. All are answering B. Clear communication within the organization. Unity in commands. Okay. Before approaching this question, I would like to give you the explanation of this 14 principles so that it will be very easy for you to approach the question. The first one is division of work. Organization, please remember, please make it so clear. I'm making it so clear. I'm not giving more content. I'm just making it so clear. Just understand. If you understand, one among this 14 might come in a question. So just understand this concept. Okay. Everything apart, just concentrate. Division of work. Organization is always having a big task, right? Breaking that big task into a small task. Okay. Breaking the big task into small task. Okay. Small task. That is termed as division of work. As per the competency of the employee, as per the efficiency, we are from the managerial, from the top level, we are dividing the work into small tasks and assigning it to each people who is working under the organization. Authority and responsibility. Yes, it is also very important. What is meant by authority? Authority is liberty, which means at certain point, the employee can make decision. Okay. Certain point, the employee is given the liability to make certain decisions. Responsibility, each and every employee should be so responsible towards their organization, right? Discipline. Yes. To attain a proper productivity, each and every employee should be so disciplined and well-mannered within the organization. Unity in commands. Just remember, to all who answered B, unity in commands. There should be one leader one command. Only one leader and one command. Not everyone in the organization talking, hey, do that, do this, do that. No. One leader, one head is speaking, and everyone has to follow that. Okay? One leader, one command. Unity in direction. When you people are working in an organization, everyone has a same goal, and every people has to work on that particular goal only. Each and every person from the top level to the bottom level, they are going in the same direction. Okay, from the same direction. Clear? Everyone is working on one common goal. That is unity in direction. All are working on that particular one goal. And subordination of individual interest to general interest. Subordination, which means what? Subordination word, it actually means suppression. It is suppression of individual interest. When I'm working in a particular organization, I cannot talk about my individual interest. The organizational interest will be comparatively more important for me than my individual interest, right? I might be having a lot of entrepreneurial ideas and all that I cannot implement inside my organization because my organization has a different goal. I am appointed to work on that particular goal. So suppressing my individual interest and working on the general interest of the organization. Clear? Next, remuneration of the employees. Periodic privilege giving, periodic increment in the salary, all kind of perks and benefits has to be given to the employees to work so efficiently. Centralization and decentralization is already discussed. Centralization is the power of attorney at the top level only, at the managerial level. Here, decentralization, the power is distributed to all people, from top level to the middle level to the inferior level also, to the subordinates also. Scalar chain. Always you'll be having communication between the like quite a difficulty in understanding scalar chain. Just remember two key points in scalar chain. The first thing is hierarchy. For example, if I'm starting in a nursing college, first is nursing principal, okay, and followed by vice principal, and followed by professors, associate professors, assistant professors, and tutors. Like that, the hierarchy is going from the top level to the bottom level. Okay. And whenever an organization is communicating something, the director will call the nursing tutor. Please, nursing tutor, you please come here. I have certain information which has to be communicated to you. It is not possible. The communication always happen from top level to the bottom level. The organization will let know the important information to the nursing principal, and followed by the principal will be conveying it to the vice principal. The vice principal will be conducting a meeting on calling all the HODs to that. Yes, now the correct answer is scalar chain. Yes, it is coming out. So what happened? Now the vice principal will call all the HODs, and the HODs will be getting that information, and they will individually conduct each departmental meetings, and they will deliver the information. So this is how the communication is happening within the organization. That is termed as scalar chain. So now the correct answer will be what? Yes, it is scalar chain. Is that clear, my children? If you have any doubt, please put in the chat box. Is this 14 principles? Everything has to be clear. So scalar chain is arranging in hierarchy. As per the hierarchy, the communication is dispersed. Next is order. Proper order of man and material. Man and material, which means proper order of man. If a person, based upon the competency, he has to be allocated to that particular position, the particular position, and material. Whatever the mandatory resources which has to be allocated for performing that particular task, it has to be allocated. So the order in maintaining proper man and material is termed as order. Equity. Each and every employee in the organization should be treated equally. Okay. From the top level person to the downmost person. Okay. Even the sanitary workers or whatever, each and everyone should be given dual respect, and everyone should be given equal distribution of respect. Okay, there should be no intimacies or no discrepancies in treating. And you even as a nurse, I'm telling you, always treat each and every patient equally and each and every employee who is working with you equally. Don't always sit in the top. Okay, there is someone who is sitting more top than us. Okay, always keep that activity, keep that attitude of treating people equally, treating people as humans, not rather than anything else. Stability of personnel. Stability of personnel in the sense, always like you have to maintain a proper stability of communication and proper remuneration you have to give, and the frequent dropouts or the frequent resigning of the employees. And you should not like always, if someone is doing a very minimal amount of mistake, or sometimes it may happen in the organization, suddenly you should not call the person and just abuse him like anything, and you cannot depromote him, right? It is not, you are not supposed to do that. Proper stability in making decisions and maintaining, like sometimes that person might be a more worthable person who is so capable enough to pertaining to that particular task. When you are suddenly depromoting him, getting in another person for that particular same work will be not so more easy for us. So those things has to be taken into consideration. Initiatives, centralization, decentralization, we discussed. Initiatives. Sometimes when the employee is coming with a good decision, you have to validate the decision and give importance to the initiatives also, and so that they also feel so empowered. Clear? Esprit de crops. Esprit de crops means what? It is always sense of belongingness to the organization. Organization should keep on strive for the growth and development, career development of the development of the employees or subordinates, so that they always have sense of belongingness to the organization. They will work hard to attain the common goal of the organization. They will be so empowered and energetic to work in that particular organization. So esprit de corps is not something which is given. It should be attained by working in that particular organization. Students, is that is clear? The 14 principles of Henry Fayol. If you have any doubts in any one of the principle also, please put in the chat box. I will clear you. So this clear communication concept from the top level to the bottom level hierarchy, it is scalar chain. Okay, that is the correct answer. So what are the other revision of work? Big task, breaking into a small task and assigning it to other workers. Please put in the chat box. Unity of commands, one leader, one command. Okay, one leader, one command. Authority and responsibility is also in there. Summative, what is summative? What is summative? Bandaru, what is summative? Okay, the last question of this session. Okay, the nurse promises a patient that they will follow up on a pain management plan. Okay, the nurse is promising a patient. Okay, promising a patient. Yes, okay, clear. Okay, great. So promising a patient that they will follow up a pain management plan by end of the day. Okay, pain management plan at end of the day. Despite being so busy, the nurse ensures that the patient pain management plan is reviewed and adjusted accordingly. Even the nurse was so busy in doing work, but she kept up her promise. Which ethical principle in nurse upholding by the following of maintaining the promise? Yes, the correct answer is B, fidelity. Okay, fidelity means what? Keeping up the promises. It is very important as a nurse to maintain such a quality, because it comes under our ethical principles. To keep this, to make it so remembering for you, fidelity of honoring the commitment to follow up of the pain management of the patient, like she's just acquired, she attained that promise, right? So it is, this is the easy mnemonic for you to understand, to easily remember this ethical principles. First is autonomy. Autonomy is the right to make his or her own decisions. Okay. Sometimes we have to make our decisions for the well-being of the patient, to improve the quality of care to the patient. So it is so much mandatory. Autonomy, always autonomy, think all by myself, all by myself. Beneficence, do right or doing good. Bene means good. Bene means beneficence, means always doing good. Fidelity, remaining loyal and faithful. Fidelity, think faithful. Keeping up promises, keeping up what you said to the patient. Accountability, responsible for all action. Think about accountable. I am accountable for all my actions. Justice, equal care for all. Just, fair. Okay, fair care for all. Non-maleficence, do not harm the patient. Non means none. Mal means no bad practices to the patient. Okay. Veracity, remaining honest. Okay, you should not confuse between fidelity and veracity. Remaining honest all time. Veracity, very honest. Remember, very honest. Veracity, very honest. Yes, my dear children, we are at the end of the session. And yes, answerable, doing good to others. Answerable, yes, good. We are at the end of the session. I hope that I have given you a maximal insight about nursing management and education. I just want a minimal feedback about how was the class been or any modifications which I have to make. Or if you have any doubts also, please put in the chat box or else we will sign off.